All right, let's dive right in. Welcome to an engineer's guide to one of the mind's most powerful and sometimes volatile engines, bipolar disorder.
So here's our blueprint for today. We're going to systematically deconstruct this complex machine. We'll look at its core components, its most extreme states of operation, and of course, the very precise tools we use to keep it all in balance.
Okay, first things first. Before we can fix anything, we have to understand the engine's fundamental design. And this isn't a one-size-fits-all situation, not at all. It's a whole spectrum of conditions, and each one has its own unique schematic.
At its very core, bipolar disorder is about an engine that just doesn't run at a steady speed. It oscillates. Think of it like a power plant that swings wildly from redlining maximum output chaos to a complete and total system shutdown.
Now, this is a really crucial distinction, so listen up. The main difference between bipolar 1 and bipolar 2 is the intensity of that high. Bipolar 1 is defined by full-blown mania. We're talking a state of critical overdrive that causes major problems and often requires hospitalization. Bipolar 2, on the other hand, involves what we call hypomania. It's still a high-output state, a big change from normal, but it stops short of a full system crisis. And for a bipolar 2 diagnosis, it has to be paired with a major depressive episode.
So, what happens when that boiler gets overpressurized? When the gears are just spinning completely out of control? Let's take a closer look at the manic state, that period of intense, unsustainable energy that is the hallmark of bipolar 1.
And let's be perfectly clear, this is not just a good mood. This is a dangerous system failure. It causes severe impairment in a person's life, their job, their relationships, and it often means a trip to the hospital is necessary. The energy is just so intense, and judgment becomes so impaired that the person's safety becomes our #1 concern.
So how do you spot an engine in overdrive? Well, we use the mnemonic dig fast. Think of each of these as a critical warning light flashing on the dashboard. And if you look at our case study of the 20-year-old male, you can see it plain as day. The grandiosity is off the charts. He claims he can sell your own genius day and night. And his rumpled appearance, well, that points right to a serious sleep deficit and a focus on activity that makes him neglect even the most basic self-care. And this brings us to an absolutely critical point. An engine that never, ever stops running will eventually break down. It's that simple. The case study nails it. Addressing that severe lack of sleep is the absolute priority. A body that can't sleep, can't repair itself, and a mind that can't rest, can't find stability. Everything else, hygiene, food, therapy, all of that has to wait until we handle this critical system failure first.
Okay, we've seen the red-hot overdrive. Now let's explore the polar opposite. What happens when the pressure just plummets, the gears seize up, and the whole machine goes cold and dark? This is the major depressive episode.
And again, this is so much more than just sadness. It's a catastrophic loss of power and function. Just look at the case of the 43-year-old woman. That sense of hopelessness, the inability to care for herself. She feels lethargic, like the system's will and energy is just completely shut down.
So for the depressive state, we have another handy mnemonic, SIG-E-CAPS. This slide lays out the diagnostic criteria perfectly. When you see 5 or more of these symptoms, you know the machine is in a critical low-power state and needs immediate intervention.
Okay, so now that we've defined the engine's extreme states, it's time to open up the Master Engineer's Toolkit. We're looking for the instruments of calibration. These are the mood stabilizers, and they're designed to regulate the system and stop those wild swings. Okay, everyone, I want you to pay very close attention to this slide. Seriously, you are going to see this on an exam. This is the narrow, and I mean narrow, therapeutic range for lithium. There is almost no room for error here. Go below 0.6, and it might not work. Go above 1.5, and you're in the danger zone. Precision is everything.
Let's talk about lithium. It's the classic, the original tool for managing this engine. Now, look at those late toxicity signs. The case study specifically calls out coarse tremor and muscle difficulties as red flags, and this is why. And here's the big NCLEX gotcha, the sodium connection. See, your kidneys think lithium and sodium look a lot alike, so if your body is low on sodium, the kidneys will hang on to lithium to compensate, and that can push the levels into a toxic range. That's why consistent fluid and salt intake is totally non-negotiable.
Next up in the toolkit, we have valproate. This is another heavy-duty tool, and it's great for things like rapid cycling. But it is rough on the engine's internal parts. For your exams, I want you to burn this into your brain: liver, pancreas, and platelets. You have to monitor liver function tests and the CBC.
Any complaint of belly pain, nausea, or weird bruising needs to be investigated right away, because it could signal life-threatening organ damage.
All right, here's another classic NCLEX trap. This next tool, it requires a very careful, very slow, methodical hand. Because if you make a mistake, if you rush it, the results can be absolutely catastrophic.
And this is why. Lamotrigine's greatest danger is Stevens-Johnson syndrome. It is a horrific condition where the skin and mucous membranes basically burn from the inside out. Your most important job as the nurse engineer is to educate your patient with crystal clarity. Any new rash, I don't care how small, is a medical emergency. That slow titration schedule exists for one reason: safety. You can't skip steps.
Carbamazepine is another effective tool, but it can shut down the very factory that produces the body's defenses, the bone marrow. This can lead to something called agranulocytosis, a critical drop in white blood cells. This means any sign of infection is a potential 5-alarm fire. A sore throat or a fever in a patient on carbamazepine isn't just a cold, it's an emergency that requires an immediate CBC to make sure their bone marrow hasn't failed.
Okay, let's pull out the next tray of tools. These are often used to calm down that acute overdrive state or to provide some long-term stability when the main mood stabilizers aren't quite enough. They work on different systems, but they are essential for good management.
These newer tools are incredibly powerful, especially for controlling the psychosis that can pop up during severe mania, and they often work faster. But they come with a significant long-term price tag: metabolic syndrome. We're talking weight gain, high blood sugar, messed up cholesterol, all of which raises the risk for heart disease and diabetes. So your job is to constantly monitor those gauges: weight, blood sugar, lipids, and to educate your patient about managing these risks. So we've laid out the entire toolkit. But you know, none of it works without the single most important component: the skilled engineer who actually operates and maintains the machine. And that's you, the nurse. Meds are just one part of the job. It's the hands-on interventions that really stabilize the system.
When that engine is screaming in the red, you follow a precise protocol. And step one is always safety. After that, you've got to reduce stimuli. A loud, bright, chaotic environment is like pouring gasoline on a fire. You provide high-energy, portable food. Think sandwiches, not a 5-course meal, because they are not going to sit still. And you set firm, consistent limits to give them the external structure that they're missing internally.
I really want this to sink in. Your words are a precision tool, just as critical as any medication. Arguing with a patient in a manic state, it's pointless. You're just adding more energy to an already overcharged system. Instead, you use clear, simple, direct language. You become the external control system, guiding the patient back from the edge, always with the least restrictive approach possible. And so we end not with a cure, but with calibration. Managing bipolar disorder is a lifelong process. It's about monitoring, adjusting, and collaborating. As you get ready for your own practice, just remember, your job isn't just to fix the machine, it's to care for the person who lives with its powerful, complex, and sometimes beautiful mechanics. The goal is stability, yes, but it's also a life filled with purpose and meaning.